8 Philhealth officials and 6 officers and employees of the Adventist Hospital Cebu are now facing criminal and administrative charges over their alleged involvement in COVID-19 benefit claims anomalies. Chari Coronel reports.
The National Bureau of Investigation or NBI in Central Visayas has filed criminal and administrative charges against the 8 officials and employees of the Philippine Health Insurance Corporation or Philhealth Central Visayas and 6 officers and personnel of the Adventist Hospital Cebu for their alleged involvement in irregularities on COVID-19 benefit claims. NBI Regional Director Rinan Oliva said that this is the 3rd case they are filing against the allegations of corruption and irregularities of Philhealth. Last October 2020, the agency also charged several complaints against the 8 Philhealth officials and 4 officials and employees of Perpetual Succor Hospital in Cebu City for their alleged involvement in COVID-19 benefit claims anomalies. In February 2021, NBI Central Visayas also filed charges against Chonghua Hospital in Cebu City for alleged false COVID-19 claims. Oliva said that the latest charges involving the Adventist Hospital Cebu were filed before the Office of the Ombudsman Visayas last June 29. Adventist Hospital Cebu's Vice President for Operations, Joel Aganan, said, as of now, the administration is still awaiting the official communication. Philhealth officials were also charged over violation of the Revised Administrative Code of 1987 and violation of Republic Act 6713 or the Code of Conduct and Ethical Standards of Public Officials and Employees, while Dr. Francisco Napigkit of the Adventist Hospital was also filed additional charges for allegedly issuing false medical certificates. Oliva said these cases stemmed from a randomly forwarded and approved claim of the Adventist Hospital Cebu. A certain Ervin Gayrama, a retired bank employee and Philhealth beneficiary, was confined on May 27 to 28, 2020 at Adventist Hospital in Cebu City due to cough and shortness of breath. Gayrama was admitted with an initial diagnosis of ambulatory and acute respiratory failure secondary to pulmonary tuberculosis. On May 28, 2020, Gayrama died at the hospital. Oliva said Dr. Napigkit, the attending physician, issued his death certificate with remarks of cause of death as COVID pneumonia probable severe. NBI said during that time the result of the initial antibody test was already available and proved that the patient was negative for COVID-19. On June 3, 2020, the result of the RT-PCR test was released by the Vicente Soto Memorial Medical Center, which was negative for COVID-19. On June 15, 2021, Oliva said the Adventist Hospital officers prepared the Philhealth claim documents and used the alleged false death certificate as basis when they submitted the same to Philhealth and continued to claim the benefit package of 333,519 pesos. Chari Coronel, Sunstar Tonight.